Well, let's quickly get Professor Olayinka involved in this conversation. Now, Prof, you've worked across borders, and I ask how you would assess Nigeria's healthcare delivery system, of course, when placed side by side, comparable economies, and where do you think that we should deploy our energy the most?
Okay, thank you. I'll start by saying that I won't talk about an assessment, but I would want us to consider a number of things in our healthcare delivery. I think one of the things that is lacking is the fact that we don't do a root cause analysis of why we are where we are. For example, we've talked about the very poor maternal mortality ratio, even the neonatal mortality ratios, which are really poor in comparison to other countries in Africa. But then we need to ask, why are we here? Why do we have it this poor? I heard about allocation of money to improve healthcare, but healthcare is very broad, it's very wide. Which aspect of healthcare are we dealing with? We first of all need to understand that systemic issues that need to be addressed. Sometimes the answer to a healthcare solution or to a healthcare problem might not be building another healthcare center. Let's look at the healthcare centers and facilities we have. What are the issues with them? Sometimes we talk about access. Access is not only a matter of distance. Access might be a matter of financial. A lot of women, particularly, they delay to seek care because of many things. It's not always a distance issue. It might be a financial issue. It may be a fact that the health facility close to them does not have the capacity to deliver the kind of service that they need, either in terms of the human resource, either in terms of the equipment, either in terms of the medications, and so on. So we need to do a root cause analysis of why we're having the mortalities. And of course, this will vary across the different regions within the country. We have delay in seeking care. We have instances in which women may need to wait for the husband before they can seek care. There was something on social media recently about a man who lost the wife and so on. There was a lot around the finances, but there was also that delay in seeking care, which probably was tied to the financial issue. And so it's good to hear about these insurance schemes, but sometimes we also have a lot of bureaucracy around accessing this insurance scheme. One thing is the emergency healthcare is actually not present in Nigeria. When I talk about emergency healthcare, the kind of intervention that needs to be done within 1 hour, and it makes a difference between survival or a good quality of life or a poor quality of life. And those are some of the things that are really missing. So I believe that the government needs to really sit down and say, okay, how do we improve our systems? How do we improve efficiency? How do we improve emergency care, which can be delivered urgently as is needed? And, you know, when if we're saying, okay, yes, we want healthy beginnings and a hopeful future, we really need to look at this. A 1 minute difference, a 1 minute delay in child delivery, either in that child maybe accessing something like oxygen, makes a difference between that child's beginning and the child's future. And we talk about our children being the future of the nation, but they really need to be healthy. And being healthy starts not just from when they're born, even before they are born. And this is where the women come into place. Let's look at our youths, our adolescent girls. How are they being cared for? How is STI care being taken care of? How is pre-pregnancy taken care of? When they get pregnant, how is antenatal care delivery? How is antenatal care process taken care of? And of course, the delivery process itself, and then the care of the newborn, and so on and so forth. So, like I said, I'm not going to compare, but I really want us to go back, sit back, and look at what the gaps are, and put in strategies that that address these gaps, and not just a blanket, we've given money or we're building facilities. That may not solve the problem that we have at hand. Thank you.
Thank you.